Thank you so much for that. And a big shout out to WSI Mount Druitt, staff and students. Great to see you here. So I want to thank the organising committee for inviting me to present, until further notice, library responses to the pandemic then and now, where we're going to unearth the connections between the past and the present to reveal a legacy of Australian library workers serving their communities, even behind locked doors. So this is about us. This is about what we've done over the last 18 months. It's about our connections to the past. And so what I want you to do is to get in there and to share your experiences in the chat as we move through the presentation. So, if you see something that really resonates with you, or you're like, yes, we did that too, please, 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 in the chat, let's share our experiences. So I think we all probably have similar images on our camera roll. What I was doing here was basically documenting my life, or my new life, trying to understand what life under COVID looked like. And I found myself drawn to the people, or trying to find people who had done this before me. This street scene depicts Sydney in 1919. And I think this image is a lot less confronting to us now than it would have been 3 years ago, had we been shown it, because we can see ourselves in it. I look at it and I go, that is a great level of compliance with mask wearing. I love that. So what we're seeing here is Sydney during the pneumonic influenza outbreak, which would go on to kill an estimated 25 to 50 million people worldwide. So to just give you a little bit of a little bit of context around understanding what we've gone through in COVID-19 with the pneumonic influenza, also known as the Spanish flu. So the Spanish flu hit Australia in 1919, but it actually emerges overseas in mid-1918. So we see reports coming out of Spain of a mysterious epidemic that has spread over the country in an alarming manner. 40% of the population have been stricken. What we have, though, is wartime censorship actually preventing news coverage of the spread of the flu outside of Spain, and that's where the name Spanish flu comes from. So here in Australia, we're quite protected. It's October 1918 that a ship arrives from New Zealand carrying infected passengers. Those people are confined to North Head Quarantine Station. And what we will see throughout the next few months is that quarantine station and that process of quarantining people arriving keeps the influenza at bay. So it's not dissimilar to what we've seen here, where people into the country into quarantine to stop the spread. However, 24th of January 1919, we have a suspicious case of illness reported in a soldier at a military general hospital. Within days, the treating nurses and also accompanying soldiers have become ill, and they're formally diagnosed on the 27th of January 1919 as having pneumonic influenza. So this is a leak or a breach from Melbourne across borders. Again, not dissimilar to what we've seen discussion of around here. So on the 28th of January, following that formal diagnosis, we have the first of several proclamations being made. And these, again, are familiar. They require people to wear masks. They disallow the congregation of people in public places, and we find restrictions on border crossings. Now, by the end of the pandemic, by the time it's run its course, we will see a death toll of 15,000 Australians. Now, that is massive at the time in a population of 5 million, and incredibly distressing on top of the wartime casualties that the country has endured. So I was seeking to understand my current situation in terms of those who had gone before me. And I was also looking to their experiences in a professional sense. What did libraries go through? What did they do? How did they respond to these proclamations? And that's what we're going to look at today. Closure and contagion. Cabinet decisions. 6. Libraries. Reading rooms to be closed. Message from the Premier, 3rd of the 2nd, 1919. The Minister directs that the following must not be open to members of the public. M. information and education facilities. Public Health COVID-19 Gatherings Order number 2, 2020, New South Wales. So this 1919 proclamation will feel very familiar. It's interesting to see that the fight against the flu uses war language. We see there each day the progress of the battle is published in the press. And for those of us in New South Wales, that really has echoes of tuning in to the 11 a.m. news conference. We're told everyone shall wear a mask, and those who are not doing so are not showing their independence. They are only showing their indifference for the lives of others. I kind of feel like I want to put that statement in my vocab for people who refuse to wear their masks. And we see here the cabinet decisions. So you can see number 6, libraries, reading rooms to be closed. And we have these general recommendations, that as far as possible, the people be encouraged during the course of the epidemic to take all possible advantage of fresh air as a means of increasing the natural resistance to infection and of lessening the risk of infection, and also to avoid crowds. So what's really familiar coming through here are, social distancing, all of those measures that we have in place now. So, of course, as a result of the proclamations, we see a spate of library closures. So those are announced in the newspapers. So library closed, the town clerk, after communicating with the health department and ascertaining that the public library in Macquarie Street, so what we would understand now as the state library, would be closed under the influenza regulations, authorised the closing of the public library controlled by the City Council. It will be closed until further notice. Now, many of us would have experienced at the start of 2020 a similar thing ourselves. So what you're seeing here is a website created by Tim Sherratt, who at the time was collating the various announcements regarding library closures and disruptions to services, etc. So many of you would have experienced the similar anxiety in those first few weeks where we were really waiting on advice as to whether the library was closing, should we still be on site, what are we going to be able to offer? And then, of course, on March 24th, the Prime Minister announced all libraries would close, and the decision was really made for us. The health advice. We have disinfected all our books out which were returned. I trust that your committee will approve of the action to minimise the danger of infection by circulation. Barrier Minor, Friday 31st January 1919. Leave books untouched in a dedicated quarantine area for a 24-hour period prior to handling and recirculating. ALIA, Australian Libraries Responding to COVID-19 Checklist for Reopening Libraries 2020. So what we see here is a clarification of the proclamation. So it is officially pointed out that the proclamation in regard to closing libraries applies only to reading rooms of libraries where people congregate and not to circulating libraries. Infection, it is explained by the Director General of Health, cannot be conveyed from books or other inanimate things, so there is no necessity to close circulating libraries. And when I was seeing this, I was thinking about, well, all of the stuff that we sanitised and quarantined, but also how we were able to continue, click and collect programs and that kind of thing. And again, if your library engaged in that, or if you have never used as much sanitizer in your life as the last 18 months, jump in the chat and share that. I know I haven't. I never expected to have a favourite brand of hand sanitizer, but there we go. So we see a range of disinfecting activities here. So this one is, we're told the books and shelves were sprayed with an atomizer, a similar instrument to that used in connection with the preparation known as radium spray. Gives me the horrors. A preparation used in some of the circulating libraries in Adelaide. Since the library was disinfected, we have been disinfecting all of our books out which were returned. It is our intention to continue this practice of spraying with the atomizer all books before placing them on the shelves. The atomizer forces in a very fine vapour-like spray through all the leaves of the book, and the smell is not an unpleasant one. I trust that your committee will approve of the section taken to minimise the danger of infection by circulation of library books. Behind closed doors. The library officers during the past 4 months have been supplying notes for these columns. Labor News, Saturday the 24th of May 1919. Join us for online story time via Zoom. at FC Open Libraries, Fairfield City. Tweet October 5th, 2021. So I'm sure that there is a plethora of outreach activities that we all engaged in. One of my favourites, we started conducting weekly Q&A sessions. So very much keeping us on our toes, but it was a wonderful way to see and connect with a breadth of users, and to just have that regularity was really, really important to us, both as staff on in the institution, and also our wider public. So again, share those outreach activities in the chat. So this one here I love. It's from the Public Library of New South Wales, so what we would understand of the State Library today. And we're told that they were writing a reader's advisory column for the newspaper Labor News. And this is really specifically targeted to workers, to the working class, and the proletariat. And this is really, really interesting because, we've got the Russian Revolution happening a couple of years previously, and here we have what will become the State Library providing a reader's advisory to the proletariat. It's awesome stuff, and I wish we had more time to talk about it. But we're told that the trustees of the Public Library of New South Wales have long been anxious to bring their institution more in touch with the workers in this state. Thinkers in all countries realise that the public library is the real university of the people. The old idea of a state library being a museum of literature does not meet the requirements of the present age. The free library is a most important part of the educational system of every modern state. It is necessary, therefore, for those in control of such an institution to realise that something more is needed than the mere collecting of literature. This something is in the direction of making the library and its importance better known. And so during this period of shutdown, they're writing this column. The library officers during the past 4 months, and this is the second lockdown in 1919, have been supplying notes for these columns on books dealing with different branches of sociology, and especially with the writings of those economists who have endeavoured to deal with their subject from the point of view of the proletariat. We truly see here knowledge is power, the library and the worker connected with the public library. It's an awesome outreach activity happening under lockdown. So libraries and community care. The School of Arts is the most suitable building available here as a temporary hospital. The library and club room will be used as wards if necessary. Delegate Argus, Thursday, the 3rd of June, 1919. From tomorrow, 500 jabs a day will be administered at Green Square Library. At Clover Moore, tweet 8th of September 2021. So for some of this next session, it's actually a sort of mirror into what we avoided. The situation didn't develop in the same way that it did in 1919, and I think for that we can be grateful. But I think it's very useful to have a look at how library buildings, School of Arts buildings, municipal libraries, those buildings were used in the broader effort to control the outbreak. So we see the buildings taken over as sites of inoculation. So unlike us, a vaccine of sorts, we can go into that, we won't here, but a vaccine of sorts was available. They didn't have the technology to understand the virus properly. Nonetheless, Australians rolled up their sleeves to receive it, hoping that it would provide protection against the coming wave. And what we see are School of Arts buildings, so many of those subscription libraries, School of Arts receiving government subsidies that would later become our sort of municipal libraries later on, we see them being used as inoculation depots. So we're told there in one example, the inoculation depot at the School of Arts Ulmara was opened for an hour yesterday afternoon. It will be open again between the hours of 4 and 5 this afternoon and on Monday and Wednesday. It is hoped that as many as can make it convenient will take the opportunity and be inoculated. The supply on hand is sufficient to inoculate about 600 persons. Dr. Cook, who is in charge of the depot, was assisted by lady members of the Red Cross. During the hour the depot was open yesterday, 42 persons were treated. And then we've got Clover Moore doing the same thing in our libraries today. So we've always said our libraries are about more than just books. Through the pandemic, city staff have worked tirelessly with New South Wales Health to ensure our facilities are available for testing, vaccinations, and from tomorrow, 500 jabs a day will be administered at Green Square Library. Now, if you are in a library that was similarly offering jabs, I know we've got examples in Victoria, we've got examples in the ACT, jump in the chat and let us know. Or if you got your jab at a library, that would be fab as well. I wish I could have. We also see these buildings taken over as sites of relief, and it really speaks to the centrality, I think, of these buildings in communities and also almost their ubiquity. So one of the ways that the government dealt with the outbreak were influenza relief depots. So essentially zones were created and these relief depots served those zones. They operated as community hubs and they're centrally located, essentially providing medical attention, food relief, rental assistance, taking care of children who had been orphaned or otherwise impacted by the influenza. So it's a mixture of medical and volunteers. And what we see is a number of these relief depots actually operating out of School of Arts sites. So Hornsby, Haberfield and Kensington School of Arts were all converted into relief depots, and as well as the Manly Literary Institute. And we've got this incredible photograph here from the New South Wales State Archives collection, which depicts staff outside the influenza depot. You can see on the front of the car there the SOS sign, and what would happen is that people in the zone, you would be given an SOS card and you would put that in your window if you were in need of relief. So beautiful classic School of Arts building there as well. We also see the buildings being used as sites of border control. So this newspaper clipping here is showing what happened when basically the Queensland border shut and Queenslanders are stranded in Tenterfield. So what we've got here are people waiting to report to the authorities who had actually set up in the School of Arts building there. And, you know, this sort of scene escalates. We have tents set up at Tenterfield Showground. School of Arts is handed over. It's a really interesting situation. And we also have our buildings identified quite early on as potentially or potential emergency hospitals. So I think it's worth remembering at this period that hospitals themselves in a lot of places tended to actually be community organised and funded. And so that match between the School of Arts, which operated in much the same way, you know, that received government subsidy but was also community based, there's similarities there, and it's not, I don't think it's a large step for people to see these sites in that way. So we're told here under influenza, so since the public meeting held last week, the local medical committee have held a couple of meetings with a view to making what arrangements are possible to deal with the influenza if it breaks out here. After inspection, Dr. Graham regarded the School of Arts as the most suitable building available here as a temporary hospital. The library and club room will be used as wards if necessary, and should there be a great number of cases, the main hall can be used later. Necessary minor alterations are being effected so that if an outbreak occurs, there need be no delay. Necessary equipment has been ordered and an application lodged for a telephone to be installed. What we see as the crisis spreads is that this emergency plan is enacted. So as the influenza hits towns, we see this sort of start to kick into gear, if you like. So we've got here Mr. Joseph Murphy, an inmate of the emergency hospital at the School of Arts, succumbed shortly after 9 o'clock on Monday night, having only survived his wife a few hours. 3 young children are thus left orphans. Reopening. Sydney getting back to normal. Hotels, billiard rooms and reading rooms likewise are preparing for Monday's reopening. Tweed Daily, Monday 3rd March 1919. We're back. Tell us how you missed us. Alia, May 2020. So what you may notice here are the dates on these statements, and they reflect the first opening. Both the library workers of 1919 and many of us in 2021 would face a second wave, a third wave, ongoing waves of reopening and closures. Nonetheless, as we reopen right now, and I know many of us are, we can share the connection across time. So I wanted to end this presentation with an example that I really feel reflects wholeheartedly the experiences we have had, and that applies just as readily to our libraries today as to those 100 years ago. So book drought broken, municipal libraries readers. It was the children who were most seriously felt the shutting of the libraries by the order of the government. Especially did the proud members of the Children's Library at the Municipal Library in Queen Victoria's Markets feel the lack of those bonza storybooks provided by that useful institution. Yesterday, all departments of the Municipal Library reopened, and though the habitual newspaper readers thronged the newspaper room all day, the children rushed their own library so eagerly that the attendants had difficulty in serving them. The rush would have been even larger if so many of the public schools had not opened yesterday. Though the main body of the public did not know it, the municipal library was reopened in an unassuming and unofficial way a fortnight ago. No public announcement was made in order to keep the attendance down to safe limits. And all the time, the library staff was at work, cataloguing and overtaking the arrears of work that accumulate in such a busy branch of public service. Thank you.
Thank you very much, Bonnie. I find it interesting, the comparisons between 1918, 1919 and just over 100 years later, how some of the things they did was, they're just very similar.
Absolutely. And I think it really speaks to, there's these core elements of what we do and how central we are to community. And so it was really interesting and quite heartening to be able to find those connections and to see that things would be okay. Do you know what I mean? They got through it, and so would we.
Yep. Okay. Is there any other questions? I'm not receiving any, so I'm presuming that there aren't any. If by all means you can post a question later on as the afternoon goes on, and Bonnie should be be able to answer that.
I will just say too that when we were putting forward this idea, I thought I'll be great. I'll be able to get into the records. We'll be able to pull out all sorts of stuff. And then, of course, everything closed. So this may have been quite a different presentation had I myself and my sources and archives not been subject to lockdown. So another sort of connection to where we are right now.
Okay, thanks, Bonnie. We'll now have a short break for about 2 minutes, and we'll then roll on with the next speaker.